Okay, I'm just gonna double check to make sure that's recording. All right, guys. We are gonna go ahead and
Okay.
get started.
And
We're just gonna
so
go ahead and ask everybody to remain on mute during the course of the um presentation, the main slides. If there's any questions, please go ahead and put them in the chat. So if you will be answering those while we're going to into the presentation, there will also be some time to answer questions before we go out into breakout rooms and as we go into the different presentations. So here is today's agenda. It looks like a lot, but I promise it's not that daunting. We're first going to go over just some high-level background information and recaps from last year's count, as well as an overview of this year's count. We're going to go over this year's preliminary volunteer assignments, talk about some COVID-19 precautions because cases are starting to spike again, as well as PIT materials. We're going to have 3 different presentations from different partners. So we're going to talk about Narcan distribution this year, DPH's mobile sites, and some encampment outreach best practices. We're also going to go over volunteer needs summary. So once we look at the volunteer assignments, we'll kind of see where we have some gaps, and we'll just refresh that, as well as some volunteer next steps before we get into our survey breakout rooms. In our survey breakout rooms, we're going to talk specifically about how to complete the 2024 PIT surveys. We're also going to go over the Voices of Youth count information, which we'll talk more about in the presentation, but that will be in the unsheltered and the service-based breakouts. We will also, for the unsheltered breakout, go over some additional information about launch sites, team roles, safety, FAQs, and some additional stuff like that. So just some background. So the Delaware Continuum of Care is a community-based collaborative that ensures a responsive, just, and fair approach to homelessness and strives to achieve housing for all. COCs are required to do a PIT count every single year, and the PIT is an annual statewide outreach effort and census count of everybody experiencing sheltered and unsheltered homelessness in our state. And as the COC lead agency, Housing Alliance plans, executes, and reports our point in time count on behalf of the Delaware Continuum of Care. So what is the PIT count? During the last 10 days in January, every COC is required to survey everybody in the COC experiencing literal homelessness. So that means people who are sleeping outdoors in cars or in other places not meant for habitation. So that's what makes up the unsheltered count. And we also have to survey everybody who is staying in emergency shelters, emergency hotel motel rooms, and homeless dedicated transitional housing. And that's what makes up the sheltered count. COCs are required to develop a methodology for conducting the PIT count to ensure that the data that we get is valid and reliable. We do publish that methodology publicly every year, and anybody who is interested can access that link there, or go to our website. It's publicly posted there as well, who's interested in learning a little bit more detail about our methodology for the PIT. So why do we do the PIT count? The PIT helps us obtain critical information on the number, characteristics, needs, and challenges of people experiencing homelessness in Delaware. It provides an annual snapshot of our homeless response system and is a key data source for how we measure our progress on preventing and ending homelessness in our state. Our data is used in a variety of different ways, and this is the really important part. So it informs legislative policy and planning initiatives. So it gets used a lot when we talk about housing and homelessness at a bunch of different tables where decisions are being made about how to create solutions. It's used to educate and raise awareness about homelessness. It's used to advocate for those strategies and solutions to address homelessness. And it helps support funding applications for dedicated homeless assistance, housing, and services. Another thing that we are just required to do it as a condition of continued funding because we receive federal homeless assistance funds. So just a recap from the 2023 PIT count. The first thing is just kind of a snapshot of what the overall count looked like last year. So we had a little over 50 volunteers statewide. We had 14 outdoor survey teams across the state. We had 16 service sites that participated in the next day count. And we distributed over 300 care bags to people experiencing homelessness. From the data that we were able to collect from the pit count last year, we know that the number of people experiencing unsheltered homelessness increased by 28% to 198 people, which is Delaware's largest unsheltered count on record since 2008. We also saw that Delaware lost roughly 1,000 shelter beds due to the expiration of some COVID-19 relief funding. And we saw almost a direct correlation in the decrease of the sheltered count. For excluding COVID years for 2021 and 2022, where our shelter capacity was inflated due to that COVID-19 relief funding, the total pit count increased by 6.8%, which again is the largest total count on Delaware's record since 2008. And just some other key demographic information. Black and African American people were overrepresented in the total pit count at 62%. And minors and adults ages 55 plus were the largest age groups experiencing homelessness during the 2023 pit. So lots of really young people and lots of older people, which are two vulnerable groups, which is a really important finding. And anybody who is interested in viewing the full report from last year, you can just access that link there. And again, it's also on our website for anybody who's interested in kind of reading into the full report. So this is just a quick overview of the 2024 pit count. It's going to take place on the 24th and the 25th this year. The shelter count will be on the 24th from different time frames from 5 to 9 p.m. The unsheltered count will be from around 9:30 to 1 a.m. And the service-based count is going to be from on the following morning, anywhere from 7 a.m. to 7 p.m. That's not for every single site, that's for all, and it's all encompassing of all the sites. So don't be afraid of that big number. It's just different sites operate at different times throughout the day. So just a couple more details about the sheltered count. So volunteers will be stationed at Code Purple sites and various other temporary housing programs across the state to survey people as they arrive for shelter on the night of the pit. Arrival to assigned sites can be anywhere between 5 and 9 p.m. And surveying will last about 1 to 2 hours. Locations, contacts, times, and more will be provided by the county leads with the final volunteer assignments. So all of those details will be sent to everybody. So please don't worry, you'll be getting all of that information. It'll just be directly via email. Pit materials are going to be provided on site or directly to designated volunteers through coordination with the county leads. So you'll have everything that you need to complete surveying on site. And one additional caveat is that some Code Purple programs are temperature dependent and will only be open on the night of the pit if it's below a certain degree. For any volunteers who signed up for the sheltered count and are wanting to do Code Purple, we will be notifying you guys as soon as possible. One, that you've been assigned to a site that we don't know if it's going to be open or not yet. And we will try to let you know as soon as possible, but no later than the day of, which I know is not super fun, but sometimes that's the notice that we get. But we will let you know if those sites will be open or not. If they're not open, we will offer for you guys to join the unsheltered or the service-based count. So we would still love for you to be able to volunteer. But if the site, Code Purple sheltered site that's not going to be open isn't going to be open, unfortunately, we would have to place you elsewhere. For the unsheltered count, unsheltered volunteers are going to arrive at their assigned launch sites around 9:30 p.m. To receive their materials and meet their teams. All volunteers should be prepared to survey until approximately 1 a.m. Teams are going to survey people who are staying outdoors in cars and other places not meant for human habitation. And you guys will be paired with anywhere from 2 to 4 people. And you'll travel by vehicle or foot, depending on the area that you're in, to known locations. Part of the pit every year is that we gather a large list of places where people are known to be, and we provide those to the volunteers and the unsheltered teams. So you guys will have places to check and to try to find people to survey. Another important thing is to make sure that you are dressing in layers and wearing comfortable shoes. Dressing in layers is probably the most important thing I could say to anybody who's part of the unsheltered count. It gets cold. Last year it rained. A couple years before it was 5 degrees outside. It's super uncomfortable and it's always not great. So please make sure that you're wearing warm clothing when you are going to be participating in the outdoor count. We also want to make sure that you're bringing your cell phone fully charged, your ID just in case of an emergency, and a flashlight if you have it, but we will be providing flashlights to teams. And all other materials will be provided at the launch site. And we're going to go into kind of a list of what that will be a little bit later. For the service-based count, volunteers will survey people as they arrive for services at varying statewide sites and times, anytime throughout the day on the 25th from 7 a.m. to 7 p.m. Again, all of those specifics will be provided to you guys in your final volunteer assignments, and the materials needed to survey at those sites will be either provided on site or directly to designated volunteers with coordination through the county leads. Volunteers will work to identify people who are experiencing homelessness the prior night, but were not able to be surveyed by unsheltered or sheltered teams. Just a quick caveat is that service locations are typically crowded. We usually try to coordinate a more private space for the volunteers to be able to survey, but sometimes that's not possible. So volunteers should just be mindful to make sure that you guys complete the surveys with as much privacy as possible, just because there's some sensitive information that's collected, and we'll go into that a lot more in detail in the breakout rooms. And one additional thing is that if anybody's missed or anybody isn't interested in completing the survey, they can also call centralized intake as part of the service-based count. So we are also going to do our 3rd youth count this year. So youth counts are a subset of the point in time count that specifically target unaccompanied minors ages 13 to 17 and youth ages 18 to 24 experiencing homelessness. Youth are traditionally one of the hardest subpopulations to gather information on. So this is one of our efforts to try to do that. This again is going to be our 3rd youth count, and we are also partnering with UD this year to complete additional youth surveying and engagement following the pit. And we're going to talk a little bit more about that in the breakout rooms as well. So youth count volunteers will be embedded in the unsheltered and the service-based counts on youth specific teams and at youth specific service sites. So we are going to get into our preliminary volunteer assignments. So I just want to make it very clear to everybody that preliminary volunteer assignments are for the purpose of identifying additional volunteer needs and allowing volunteers to make changes if needed before the week of the actual pit. These assignments today are not final and they are definitely subject to change. If they are any changes, or if you're moved around, or if you need to make any changes, we will communicate that to your teams and anybody else who needs to have that communicated with them following when that change needs to be made. So just a time frame for what that looks like. We are asking all volunteers, if you haven't already signed up, or if anybody else is interested in signing up, to do that by the 18th. That's going to be our volunteer sign up cutoff. Then on the 19th, we will be sending out final volunteer assignments. So you will get your team member contacts. You'll get the, if you're going to like a site, you'll get the site contacts. You'll get all of the details and the information that you need to know about what your assignment is going to be. But please let us know once you look at today's information or once you get your final volunteer assignment if there needs to be any changes or if there's any issues, because we definitely want to try to be taking care of that before the week of the pit. If I can stress anything enough. And we do understand that there's last minute changes that happen, but we really want to try to take care of that before the actual week of the pit, because that's when we're going to be away from our computer a lot, making sure everything is getting where it needs to go and to who it needs to go to. And we definitely don't want to try to be playing around with the teams at that point. So please let us know before the 19th if you have any changes or issues today, or please connect with us so we can talk more about it. So Monday and Tuesday, the 22nd, and that should be the 23rd, I apologize. We will notify teams if there's any changes or updates to the assignments, and we will notify any temperature dependent Code Purple volunteers if those sites will be open, or if we are going to be asking them to move to a next day or unsheltered team if they would like. And again, just please contact us if you have any questions or if you need anything or have any specific requests. Before we get into those preliminary assignments, we just want to go through the COVID-19 precautions. Cases are going up at a rapid rate again, and they're spiking in a lot of different places. So we just encourage all volunteers to take rapid tests 24 to 48 hours in advance of the count. And we do encourage wearing masks while surveying, especially when you're in the car with others. But we do leave it up to you guys on what you want to do for that. But we do ask that you don't participate if you have any of those symptoms listed, or if you tested positive or were in contact with anybody who tested positive within 7 days, unless you have tested negative within 5 days of that exposure. So if you're feeling sick, or if you've been around anybody who has had COVID, or if you've had COVID and you have not tested negative again, we really ask that you don't put anybody else at risk, and that you don't participate, and that you let us know if that's going to happen. Right. So these are the preliminary New Castle County teams. Right now, it's just showing the unsheltered, and sheltered count. We are going to, on the next slide, look at the next day sites. I just couldn't fit them all on one slide. So I am the county lead for New Castle County. So any changes to teams or any questions about the teams that are here, we will be directed to me. Please feel free to give me a call or shoot me a text to any of the contact information that's listed there. We are looking at needing about 8 to 10 volunteers to fill out 2 additional teams. If needed, we always try to get around 8 teams for the county that aren't like agency specific, and just to get more people in case anybody's not able to participate anymore. So where it's highlighted yellow is where we have room to fill out the teams if people have not signed up. Just some other information into the color coding. So we are still waiting to hear back from 2 teams on whether they are able to participate. So that's where the to be determined is. And we have a couple other agency staff that are completing different parts of the count. We have 2 youth teams that have been filled out, and right now we are looking at trying to fill out 1 additional youth team. So if anybody's interested in that or wants to be involved in the youth count, again, just let us know. And Code Purple is going to be one of the things, again, that is going to be tricky towards the end. So we know for sure that Friendship House has Newark Code Purple, but it is going to be temperature dependent. They are deciding whether they're going to have Wilmington and Middletown sites. So we aren't sure if they're actually going to have those sites yet. And then we have the additional temperature dependence on top of that. So I have some volunteers listed there now on the chance that they do have those sites and that they're going to be open. But again, I will communicate with you guys on if they have that. I have a meeting with them tomorrow to talk about those details. So hopefully I will have a little bit more information on that in the coming days. I'm going to cover it in another slide too, but if you don't see your name here, it's probably because I didn't have you on the volunteer sign up form, or I didn't have like an email about wanting to sign up and where you want to participate. So if you don't see your name and you want to be on an unsheltered team and you're planning to participate, I really just encourage you guys to fill out the volunteer form. That's the easiest way for me to make sure I have the information that I need to get you where you need to go for the count. So these are our service-based sites currently. So we have around math 8-10 sites. That was so hard for my brain right then. But we are still looking to fill them out a little bit more. We do have preliminary times here, but again, we'll be providing much more detailed information when the volunteer assignments go out. But we are looking for 6, 8, 9, 10. I have this on another side, but we're looking at about 10 to 12 additional volunteers needed here. So if anybody is participating in the sheltered or unsheltered count and is willing to volunteer again for the next day sites, or if anybody is just interested and you don't see yourself listed, just reach out to us or fill out that form and we'll get you on a next day site team. For Kent County, the county lead is going to be Rachel, and her information is there. So she'll be the one communicating with the Kent County teams for the final volunteer assignments and for any changes or anything that need to happen after today. She was unable to be on today, so I'm going to be going over this for you guys. We're looking at 3 to 4 outdoor teams for the overnight and a couple different teams for some outreach in the morning next day. We are looking at 2 different Code Purple sites in Kent and we are needing around 8 more volunteers. I'm like looking at our names. Volunteers for the next day sites. So we need a couple more people for the library, for Brandywine Milford and for Hopes and Dreams. And yes, Sean, I am going to be emailing out the slides after the training, probably on tomorrow or Tuesday, depending on how fast we're able to process the recording and all that good stuff. And then on the 19th, we will be sending out emails with the final volunteer lists. So if there's any issues or questions from what you're viewing here, please let us know again sometime between now and the 18th. And then we will send them out on the 19th. And then if there's any additional changes, your county lead will be the one who you coordinate with after that fact. And for Sussex County, Sophie is going to be our county lead, and you can contact her at the numbers and email there. So we are looking at around 4 teams, 2 on the east side and 2 on the west side. We are still in need of quite a few volunteers for Code Purple sites. We are going to in the past, Code Purple has been able to help us, but with capacity and different things like that, they are requesting volunteers this year. So if anybody is in Sussex County and is able to help out with Code Purple, that's one of our main needs. I'm sorry, Lee, I will definitely fix the spelling when the final volunteer stuff goes out. I'm sorry about that. And we are also in need of a couple additional volunteers for our next day sites, particularly the ACE peer centers. So 1 to 2 people per site we would need some help with there. And thank you, Olivia. I will, or me or Sophie will make note that you are able to also do the Dover Library. I really appreciate that. So that's it for preliminary teams. I know we went through that kind of quick. We will again be sending those out. If you have any additional questions about that, please just reach out to us or give us a call. And again, there will be changes as teams expand or condense, and we'll make sure that we are in as much communication with you guys as possible related to that stuff. We just ask that if you have any changes, as much as you can, to please let us know or get back to us by the 18th, or if you did not see your name there and you want to see your name there, to sign that volunteer form by the 18th, so that we can make all of those fixes as much as possible by the time we're sending out those teams on the 19th. So for pit materials, all volunteers are going to receive materials to help them conduct the 2024 pit. If you were on an unsheltered team, you're going to get unsheltered surveys, you're going to get clipboards and pens, you're going to get care bags, and we're going to talk about those in a little bit more detail in the next slide. You'll be getting flashlights, you'll have maps of the state with volunteer zones listed. You'll also be receiving lists of known locations and some form of pit count identification. So whether it's a magnet to place on your card or a like laminated piece of paper that says pit count volunteer that you can place in your window, just some way for you guys to be able to identify yourselves. And if you're participating in the sheltered or the service-based count, you will be receiving those specific surveys, clipboards and pens, particularly if you're going to like a co-purple site, and you'll get care bags, but the care bags will be supply dependent. We were very fortunate to get quite a bit of donations this year, so I'm hoping that we're able to provide them to as many different service-based sites and sheltered sites as possible, but we always do make sure we prioritize those for the unsheltered count primarily first, and then we trickle out from there. So hopefully we will be able to do that, but again, it'll be supply dependent. And to talk a little bit more about the care bags. So each year we work to get donations to create care bags filled with winter supplies and basic necessities to distribute during the pit count. So that's hats, gloves, hand warmers, chapstick, tissues, hand sanitizer, the whole nine. And care bags, this is a really, really important thing, are to be provided to every single person you encounter who's experiencing homelessness, regardless of their willingness to complete a survey. So they do not have to complete the survey in order to get a care bag. The care bags are not like a leveraging piece or like a compensation for completing the survey. The care bags are meant to go out to people who need them during the count. So that's just a very important point, is to make sure you hand them out regardless of whether that person's going to actually do the survey or not. Now, if they don't want it, then you don't have to force them to take it. But we do try to get them out as far and wide as possible. So with that, we were going to have our good friend Amos present next about Narcan kit distribution, but he was unable to get on. So I believe Sophie is going to go over those slides. So I'm going to stop sharing my screen and allow her to bring those up. One moment. All right, you should be good. So.
All right. So we are very excited. We're working with DSAM this year, and we are officially partnering with them to be distributing and handing out Narcan kits along with our pit count care bags during the count for this year. What that's going to kind of look like is, again, all of the Narcan kits will be included with the bags, and they are to be distributed by the certified volunteers. So we did have a prior training on the 4th. If you attended that, you should have gotten a follow-up email as well. And I think you should be receiving your certification soon. If you would like to distribute the Narcan kits during the pit count this year, you do need to be certified to do so. And we have a free training available again on the 18th. If you are already certified in Narcan distribution through DSAM, you can actually let us know. And if you would, that way we can have you noted down that you would be able to distribute the kits during the pit count this year. Again, the training is going to be next Thursday, the 18th from 3 to 4. It's going to be held virtually over Zoom. If you are interested in attending, please reach out to me directly. We will make sure that you are added onto that Outlook invite and receive all the information for that.
So if I would just want to add two caveats, we did ask ABMOS, this is a, unlimited certification. It's not something that needs to be redone. There's no expiration date, so once you're certified, you're certified. And we would love everybody to get certified, but we are really hoping that at least one person per team will be certified, because we will be placing these kids in a majority of the care bags, particularly for the unsheltered count. So we just need at least one person per team, who is able, or who is already certified.
Thank you, Erin. Yes, and just to piggyback off of that again, if you're a team lead, especially too, if you're a team lead and you're not certified and you'd be interested in, definitely something, a good thing to sign up for, but anybody on the teams we would really appreciate. And again, this is something that you would be certified for forever as well too. It's a cool little. Amos made these slides, so he did a lot fancier transitions than I'm used to. But a little bit of what you're actually going to be learning about during the training, it's going to be going over what is Naxalin, what is Narcan itself, recognizing the signs and symptoms of an overdose, opioid overdose responder training, storage and expiration, administration, and then as well as the standing order. Not all the information, not everything in the training is necessarily going to be applicable specifically during the point in time count. However, it is necessary that you receive the full training in order to be certified for distribution. And it is something that, whether it's within your day-to-day work or just going around out to life, I think it's a good life skill to have. So there are very important, very useful information that is going to be shared. And we, anyone who's actually interested in having a trainer come to their site and do this with their staff on a separate event as well too, are more than welcome to reach out to the DCM Naxalon support team. We will be having another presentation about this during our January membership meeting next Wednesday on the 17th with more general information if people are interested in contacting them to have them come train staff. But again, this is kind of just for the volunteers. If you would like to be certified to distribute the Narcan kit bags, please let me know and we will get you on our training next Thursday, the 18th from 3 to 4. And I think that is actually all I have. So I'm going to go ahead and stop my screen share. And again, all the information will be sent out afterwards. So as far as the contact information for these people and everything like that, we'll make sure that you guys receive that too.
Awesome, thanks, Soph. So we are at a natural break before we are about to go into the DPH mobile unit sites with John Smiley. So I just want to take the time to open the floor up if anybody has any specific questions right now. And if not, then we will go ahead and let John share his screen for that.
I had a quick question, which you were referring to the team leads. How do you know who on your team is the team lead? I don't see it on the chart.
Whoop, I'm sorry, I was explaining the color coding and I forgot to explain it. So everybody who signed up that confirmed that they would definitely want to be a team lead is bolded in black. So when you see the slides, those who listed on the team bolded in black were definitely said I will and can do this. But part of our outreach to the teams as the county leads will be to confirm that whoever is on the team definitely wants to be the lead and is able to drive and transport the team. Not every time does the team lead have to be the person who's transporting them, but we will be working all of that out as well. But as of right now, anybody who filled out that form that said yes is going to be bolded in black when you receive the slides. And so I just heard the doorbell for the Amazon order. If you could hop up for that. Sorry, we're receiving a big order donation today. But I want to make sure that I'm still on for you guys. Was there any other questions?
I did have a quick question. On the Sussex County slide for volunteering, it didn't say separate days, but I guess like if I'm assigned 8 p.m., then that would have to be the 24th, right? Because you're not doing late on the 25th, are you?
So it would depend. And let me back up real quick to see where I have ya. So yeah, so for code purples are going to be on the night of the 24th. So that would be 8 to 9 p.m. on the 24th.
Okay.
Yep, so outdoor teams and Code Purples are gonna be the night of. Anybody in the dark gray is gonna be those next day sites. And those can be anytime from 7 a.m. to 7 p.m. Not all of them are at that time frame, but that's just the entirety of the day. The
That's
different
very-
sites and stuff are gonna be doing stuff.
Very helpful, thank you.
Yeah, no problem.
I had a quick question.
Yeah,
It said to be, our timing was to be determined,
for
what is it,
Code Purple for Newcastle.
BCC, I think it was BCC.
Oh, Milford, BCCS Milford.
I don't know. It flashed, at first I didn't see my name and then I seen Shantae
Double
Terry.
check.
Is it Brandywine Counseling or BC? I don't really know what it was for. It just came up and went away
Oh.
so fast. So I was like,
Yeah, I'm sorry. Brandywine Lancaster location. They have definitely confirmed that they are that we're allowed to be on site and that we can survey there. But I just haven't gotten to touch base with them in detail yet to determine what time you guys will need to be there. I know that it'll be in the morning. I
Okay.
just don't know exactly what time yet. And I'm hoping to get that figured out either tomorrow
Alright, and that's
or
on the
early next week.
and that's on the 24th, January 24th morning.
25th.
I mean,
So
25th,
all service-based
25th.
counts will be the 25th. Unsheltered, so outdoor, and Code Purple will be the 24th.
All right, so, this is, okay. Okay.
Hi. And again, I'm gonna be sending these slides out to everybody, so don't panic. You'll get all of the information that we went over. We will also be posting the recording as well, so you guys are able to go back and listen to the information and view the training again.
Hi, Erin.
Okay.
My name is Coral and I have like a question. So like when you guys sent out the initial sheet for like the team.
I think we froze. Well, I do not want to take too much time. I'm gonna message her to make sure that we can connect to answer that question. But for the sake of time, I do want to pause on the questions right
Hi,
now.
so sorry about that. Like I actually
Oh,
like my
perfect.
device just went down. Can I ask you just like one more question before we segue to the next thing?
Yes, you can.
So I was just wondering, like, I know it said you were saying that if you specified that you wanted to be a team lead, that you would have put it in the, I guess the survey. And I did initially put the survey or complete the survey as a team lead, and in the, I guess, preliminary document, I did see that, you know, that I was, but like, I didn't see it. So I was just wondering, like, is there a way, do you want us to like email you if we did, like, if we are interested in being the team lead still?
Yeah, so really the team leads are kind of primarily most important for the outdoor teams. And I have you down for the next day sites. But if
Okay.
you want to be the person that coordinates with me to get the materials for that site, and to kind of be like I give you the care bags and you have the surveys and the other volunteers will get their surveys from you when they meet up with you at the site. Then yes, if you just want to let me shoot me a quick email and let me know. That actually makes my life a lot easier.
Okay, perfect.
Anytime you guys
perfect.
are able to do that stuff and you just want to offer, I love that and it makes me happy. So you just shoot me a quick email and I'll make that note.
Okay, thanks, Erin.
Thank you. Okay, guys, again, and we're gonna have breakout rooms, so there's gonna be more time for questions, but I'm gonna go ahead and let John take it over, to talk about, the DPH mobile units. Maybe. There we go. John, you're on mute just in case.
Okay. All right. Can you guys see everything? Everything's good.
Yeah, we can see you now.
Is it on the big screen or is it on the like section screen? I can't tell.
It's on the presenter view.
Okay. All right. Hang on 1 second.
If it makes you feel any better, I despise PowerPoint and trying to share and present on Zoom at the same time.
Yeah. Okay. All right. Now it should be on the right screen. You guys good? Can you see
Yeah,
everything?
you're good.
Okay. All right, so my name is John Smiley. I'm a planner for Newcastle County Health Services. I'm going to talk about the mobile health units that we'll have out on the 25th. So in Newcastle County, we'll be at the St. Patrick Center, which the address for that is 107 East 14th Street in Wilmington. And that'll be from 9 to 12. So we're going to get there at about 8:30 to set up. If anyone needs anything, we'll be at that location around 8:30, getting everything set up. And we'll be offering, the services that we'll be offering will be the same for all 3 counties, but it'll be HIV testing and counseling, COVID vaccinations and testing, influenza vaccinations, blood lead screenings for children, diabetes screenings and blood pressure readings, cholesterol testing, and clinical and community resource connections. We have like a bunch of education and outreach packets for a bunch of different organizations in Newcastle County, and for Kent and Sussex, it'll be the same for those counties as well. For Kent County, we're still working out where we'll be at and the times for that. So we will update this, and it will be updated for the next presentation, and you guys will get the updated version of the time and the address for that. For Sussex County, we'll be at Higher Ground Outreach, and the address for that is 12 East Pine Street in Georgetown, Delaware, and that'll be from 11 to 2. So we'll be there about 10:30 to begin setup. Same services offered as Newcastle County. And if you guys have any questions or interested with anything, you can always reach out to the staff on site. The next slide will have my contact information and the planner for Kent and Sussex, Okima Perry. If you guys are interested in scheduling events other than the 25th, you can always reach out to us in email, and we'd be happy to work with you guys and figure something out. That's pretty much all I have for today. If you guys have any questions, I can field those. All right.
Well, thank you, John. We appreciate it. He will also be going, presenting at the quarterly meeting, to go into a little bit more detail, about the mobile unit and how you guys can have them, at your site. So if anybody, again, has any additional information about that, there will be another opportunity to connect with John and kind of listen to, what they are doing, with the mobile unit at the quarterly meeting next week.
Thank you guys for giving us the opportunity to be a part of this and to present. If you guys have any questions, please feel free to reach out to my email, and I will field them as they come in. Thank you.
Thanks, John. All right, and next up, we will have Shelby from Brandywine Counseling, who's gonna go over some encampment outreach best practices. We are gonna go over this with the full group because I think there's a lot of good information in there about how to approach conversations and how to approach people. So even if you're not doing the unsheltered count, please listen and kind of take this in because it's a really good message and there's really good information in there. But then after we're through with this, we're gonna have 1 to 2 more slides just to do a quick review, and then we're gonna go ahead and get into those breakout rooms. So Shelby, whenever you need me to change the slides, just let me know.
Perfect, thank you. Hi everyone, my name is Shelby Pulse. I'm a program manager with Brandywine Counseling Community Services, and some of the programs I help oversee include our unhoused programs, which I'll get a little bit into in a second, but we can go ahead and go to the next slide. So if you're not familiar with Brandywine Counseling, we are a nonprofit that serves individuals who are experiencing mental illness or substance use disorder. We do a lot. We basically do everything except residential housing. So I would just encourage you to check out our website to see things that you might be interested in, or if you know anyone that would be interested in them. And then my email's at the end. So you can always shoot me an email and I can connect you with the right person. We can go to the next one, sorry. All right, so the 2 unhoused programs that I have, our first one is Home for Good. And this program essentially serves our unhoused and our displaced population, so people that are experiencing homelessness in Kent and Sussex County. And they have the end goal of connecting them to some type of housing, whether that's temporary or permanent housing. And we also do a lot of in-between work. So there's like connecting them to resources, giving them emergency supplies, like tents and tarps, things to help keep them as safe as they can in the situation that they're in. We can go to the next slide. And then we also have our PATH program, which is very similar to Home for Good, but there is also a lot of referral and case management that goes with that as well. So same thing, we're going to serve that homeless community and those homeless populations, try to connect them to housing as best as we can. And then there's a lot of follow up and follow through with that. So they're very much kind of hand in hand with them through that entire process.
Particularly at Urinal, where we have new information.
Go to the next slide.
Being able to feed that information to the audio.
Okay, so, sorry, go back. I didn't realize they already.
Oh,
Sorry, Shelby, I accidentally muted you.
Okay, sorry. Okay, so what to expect. I do want to emphasize that I'm not giving you guys this information all to scare you. It is just because you're possibly going to be around individuals and communities. That's something that you're not used to, and that's totally okay. And you might just see things that you don't see every day, and that's totally okay. So this is just to kind of help you guys approach it the best way that you can, and then to stay safe as well. So what to expect when you're entering an encampment, which is going to be like almost like a tent community in the woods. That's what an encampment usually is. You just want to be mindful that this area is what people will classify as their home. So it's the same way that you don't want someone like barging into your house and being disrespectful. It's the same way when we're entering the encampments. So just enter them calmly, be as respectful as you can. Again, you are going to be entering wooded areas and they can be deep. So the tips that Erin gave about how to dress definitely suggest that if you are going to be in an unsheltered group, try to especially keep like your ankles and your wrists covered, because there might be bugs and you don't know what's going to get around you. So just keep that in mind when you are choosing what to wear. Also, if you have any type of hiking boot or like thicker shoe, definitely suggest that as well if you are going to be entering the woods. You'll be able to tell because there's usually a trail. So you'll see some type of entrance. They have to have some way to get in there. Sometimes there's not, but most of the time you're going to see an entrance near the encampment. So you know that's going to take you to where you need to go. Some encampments are not well kept. Some keep them very clean. Sometimes there might be a lot of trash. That includes needles. So you just want to be very mindful of where you're walking and what you're around. You may also see paraphernalia or alcohol, and they can be actively using as well. So we have walked into encampments where someone is like actively using their drug of choice. So just be mindful of that. You may see makeshift bathrooms because again, they're outside. They're most likely not going to have a porta potty or like, just a bathroom in the middle of the woods. So you might see like holes where people have used the bathroom, or you just might see it on the ground. So again, this is just where you want to be like mindful of what your surroundings are, just to be careful with that. And then again, you may see individuals who are under the influence. So there might be people who are actively using, and that's just, again, where you want to be mindful of your surroundings, mindful of what's going on around you. And we can go to the next slide. Okay, so when entering an encampment, again, I'm just going to stress this and just think about if this is your home. I know it's normal for some people to like barge in, but you wouldn't want a stranger to barge in. So just be respectful of that. Don't enter the space rapidly, just like walk in a little bit slower, not like, you don't have to like stand there and yell, but just enter it a little bit slowly. Approach it with a calm and relaxed demeanor, and then definitely announce who you are. So like my team, when they go out, they'll just be like, hey, it's outreach workers from Brandywine Counseling. If you're just volunteering, it's, hey, I'm a volunteer with PIT. You just want to let them know, especially if we're going out in the middle of the night, they might think it's the police or probation. So this is really helpful. You want to make sure you're announcing yourself. And then also announce why you're there. So again, like, hey, it's Shelby from PIT. I'm just here to, get some information, do a survey. I have supplies for you, kind of thing, just so they can be more comfortable with you entering their space. We can go to the next slide.
Just real quick, I will also add, we do have a flyer on our website, and that we have tried to distribute out as much as possible, specifically targeted to people with lived experience. So if any of you guys are service providers or are interacting with clients who are coming in and out of encampments, we did try to blanket as much as possible to say this is when the pit count is, this is what to expect, there will be teams, they will announce themselves. So we have tried to do we have tried to prepare people as much as possible on what to expect for the count. So just in terms of notifying them that you're going to be there. I mean, some people it might be a surprise, but a lot of people will know that you're coming.
Yes. Okay, so street outreach, this is anyone that you're gonna see outside of the woods. So you might see them quite literally on the street or at a Wawa, in front of a community center, something like that. Same thing, you just want to be prepared to announce yourself, especially if they don't know who you are. They might be a little bit timid or reserved about who's approaching them. You always want to keep a safe distance because you just don't know how the person that you're speaking to is going to react. So you want to make sure that you have that space. Smile while you walk. This is just pretty much reminding you guys not to like come up like very, very aggressive, like kind of just same thing, like relax, smile, just like remind them that you're just a friendly face. So you don't want to scare them off. Same thing, you might see individuals under the influence. And then you want to be mindful about who you take direction from. So if someone is, you're talking with them and they're like, hey, like, let's go over here and talk, or can you come over here and see something? Especially if it's going to be in a space where nobody's going to be able to see you, because some might just want to veer off a little bit because you are getting personal information from them, but you do want to make sure you're in sight so people can still see you. There's still people around, like your team is still around you. They can kind of like point out where you are if need be. If they're trying to take you like around a corner or completely away from the group, I would not suggest that at all. You want to make sure that you're in eye view of your team. So your street outreach approach, really similar to your encampment. You just don't want to enter the space rapidly. You want to be calm about it. You want to have a relaxed demeanor. You're going to want to announce who you are, like, hey, how are you guys doing tonight? It's Shelby from Brandywine Counseling. We're just here for PIT. We got some supplies for you. Just want to see if we can survey tonight. And then same thing, announce why you're there. So just about the same thing as when you're entering an encampment. Okay, so some safety tips. We do not recommend safety checks. So if you can tell that there's someone in a tent and they're not responding to you, there's a slew of reasons why that could be happening. So you can kind of like try to read the room a little bit, see if you do actually need to involve anyone else at that point. But please do not unzip their tent. It's the same thing, like you don't want a stranger barging into your house. You do not want strangers unzipping their tent. Do not touch their personal belongings, same way I wouldn't want someone just sticking their hands into my purse or whatever is with me. You also don't know what's in there because again, some of these people might be actively using, there might be needles, there might be pipes, there might be stuff like that in there that you just won't want to touch. Be mindful of your surroundings, talked about this a little earlier. So needles, weapons, waste. Again, I'm not scaring you, but sometimes when we've been in encampments, we have seen like knives on people. So you just want to be mindful kind of your surroundings and what you're getting exposed to. And then I cannot emphasize this enough, read the room. If your intuition is telling you that something is not okay, that you do not feel safe, don't even question it, just leave, just exit immediately, get yourself out of the situation immediately, I have like a safe word with your team if you need to, just get out of that area if you need to. Okay, so what to do if you might see some like emergency situations going on. So if you approach an individual who is combative, this is going to be repetitive, but at the minimum, you do want to make sure you're in pairs of 2. And it doesn't mean that you have to approach people in pairs. You just want to be near your partner because again, it's just not going to be safe if you're removed from the group. So make sure you're in pairs. Do not fight back. I would not recommend that. Get out of that area as quickly as you can. If you approach an individual who's experiencing a crisis, so this might be that they're going through like a mental health crisis where they might be thinking about suicide right in front of you. or if they're just almost like having like a mental breakdown, like something you're not really sure that you might be able to handle. Again, same thing, you want to make sure in pairs, you want to make sure you're in eyesight of your partner. Check to see if a professional is near. So you might be with someone who does this for a living that might be able to step in and help. If they're not, if you need to, exit the area and then call 911 if they're necessary. So like if they're like, God forbid, actively trying to like, you know, harm themselves in front of you, you do want to call 911 if you can, if you feel comfortable. But I would definitely suggest that. And then any medical emergency, again, make sure that you're in repair, make sure you're in eyesight of your partner. Use your discretion if you're certified. So if you're CPR certified, if you're a medical professional, if that's something that you want to step in and do, use your discretion at that. Check to see if a professional is nearby. Again, if you're with someone that's in the medical field, or if you're with someone that's just in a field where they're certified, see if they would be okay with stepping in at all. Call 911 and then stay near if possible, especially if you're in the woods, because the last thing that we want to do is, you know, like something severe happens, someone's like bleeding in the middle of the woods, and then we leave and they don't know where to find them. So I'm not telling you have to stay directly next to them, but maybe like stay outside of the encampment and be like, hey, they're like back here to the right. But again, this is just all whatever you're comfortable with. And if you don't specifically feel comfortable with it, see if anyone on your team is comfortable with handling it. All right, so trauma-informed conversations, because most likely you are going to be dealing with people that have experienced trauma. Homelessness in itself can be very traumatic. So just kind of how to navigate these conversations, especially if some people feel comfortable talking to you, they might open up a little more than you were expecting to. So being a trauma-informed means recognizing an individual's history and needs to approach conversation about trauma with respect for their experience. So you want to remain respectful and encouraging of the experience that they share. You want to stay focused on the purpose of the conversation. So you don't have to offer solutions for them. Sometimes people just need to get it out, and they're getting it out in the conversation that they have with you. So you just want to be respectful of that, let them speak on what they want to speak about, and kind of keep the conversation in that field. And then, you know, you can just ask questions that are more trauma informed. Especially like if you do run into a person that's experiencing a crisis and you do feel comfortable trying to like help get them a little bit calmed down while professionals step in at that point. So you want to use terms like what happened to you, what's going on with you, how can I help, how can I support you? Those are the two that I use all the time. How can I help and how can I support you in that moment? Until again, like if we need to call a crisis unit, that they come out and they can step in at that point. But the main thing is again, some people might just feel comfortable talking to you about this. So this might just more be like in the conversation of you getting the survey, you just want to remain respectful. You don't have to give them advice, and then like don't invalidate like their experience of what they're going through. We can go to the next slide. Okay, so just some tips on that. So do not force them to talk. This can re-traumatize them. So if they just share a little tidbit with you and don't go any further with it, just leave it at that. If they do go a little bit further, you want to listen. You want to allow them to talk without interruption. And again, this is going to go if they just share with you in the survey, if you actually run into a crisis. So this is just, again, where I suggest like not really giving advice. It's just sometimes it's not the moment. It's just being there to be present or to support them. You want to create a safe space as best as you can in that moment. Try to understand their triggers if you're just listening and you're getting a little bit tidbit of what's going on. So maybe it's like someone who just fled from a domestic violence situation. You can kind of like, if there's a male with you, maybe it's like, hey, like, why don't you back off a little bit? Or if it's the opposite, it's the male that fled, tell the female to back off for a little bit. And then same thing, just don't invalidate their trauma. It's their trauma. It's what they consider to be a traumatic experience for it, and that's what it is. We can go to the next slide. All right. Aaron, I don't know if you want them to ask questions now or if we want to do that later. And then, oh, so I'm so sorry. Here's our contact information. So mine's at the top. Herman Littleton and Jennifer are on this training with us today as well. So Herman is my Home for Good outreach worker. So if you ever need anything, you can contact him. You can contact me as well. And then Jennifer Holbrook is my PATH outreach worker. And both of their programs serve Kent and Sussex County.
Shelby, if you're gonna be on and coming into the unsheltered room, I think that would probably be the best forum for
Okay.
those questions. Just so that those who are doing like the sheltered or service counts can have some time in their breakouts as well.
Awesome.
And I did see a question in the chat from Ms. Terry. Are the police and emergency services notified that we'll be out in communities? So we do notify the police departments statewide about well, you try to do it about a week in advance, but we usually do it a couple days in advance. There is no guarantee that the people that we notify are going to trickle that information down to the officers that are on patrol that night. That is always the goal, and we do ask them to do that. But as with any transfer of information, sometimes it does not get where it needs to go. So we will definitely, I mean, we've had it happen in the past where people have been stopped or pulled over, but we do try our best to make sure that all of the different departments are notified that the count is happening. Okay, guys, we're gonna move on to just a couple slides before we get into those breakouts. We will definitely have more time for questions and stuff then as we're going through the surveys and some of the additional information. So this was just a recap from our preliminary team slides before of kind of where we are seeing some gaps and where we need some more volunteers if possible, or if anybody wants to volunteer to do more than one site, more than one count. So for the unsheltered count, right now we're needing the most volunteers in Newcastle County. So we are definitely looking for more overnight volunteers there. In Kent and Sussex, where our teams are actually pretty filled out, fingers crossed. So we're only needing maybe 2 to 4 more volunteers there. So we are super excited about that. For the sheltered count, we are needing some more volunteers in Sussex. We have 5 to 7 there. We could go anywhere up to 10. So we are definitely looking for more people in Sussex for the sheltered count. And for service-based, we need the most people in Newcastle County. And that's not including the agency teams and the agency staff that we've been talking to who are going to be doing it on their sites. This is just general volunteer teams. And in Kent, we could use 6 to 8 more volunteers dispersed between the sites and the library. So that's just a quick overview, quick snapshot of how many more people we're kind of looking for that. So what are the volunteer next steps? Complete the volunteer form. If you have not done so already. I know completing forms sucks, and I'm also the worst at it, so I feel like the biggest hypocrite ever asking, but it is really, really helpful. It has all of the information in there that I need to be able to get you guys where you need to go. So if you didn't see your name on the preliminary assignments and you're planning to participate, please, please, please complete that form by the 18th. The 18th is when we're gonna kind of stop taking a look at it and stop accepting new volunteers. And that's what we're gonna use to send out the final teams. So please either let us know. And if you don't want to fill out the form, take a look at the form and let us know the information we need to know via email. As long as I just get that information some way, shape, or form, I'm not picky, but the form is the easiest way to do that. Along with that, we're going to need you to complete your volunteer waiver. So every person who participates in the PIT is required to complete the volunteer waiver. We will be printing out copies and providing them on site. And for the unsheltered teams and stuff, if you weren't able to do it in advance, it's just easier sometimes for people to submit that to us in advance so that you don't have to worry about it and that you're covered. You can go to those links. And then once you complete it, you can send it right over to Sophie. We will be reaching out the county leads to all of the volunteers. But in advance, again, if you're no longer able to volunteer, if you have any specific needs or requests for your assignment, or you have any questions about your assignment, please just reach out to us. That's going to be myself, Sophie, or Rachel, for the 3 counties. So please just keep in communication with us, so that way we can make sure that this goes as easy for you and for us as possible. And then lastly is just to review the materials. So again, this training is being recorded, and we'll be sending out the slides as well as the training surveys and stuff that we'll be going over in the breakouts. We'll also be posting it to our Pitt Count webpage, which you can access via that link. So anybody who was not able to stay the full time, didn't catch something and is interested in going back to listen to it, or for any staff that might be doing the count and once wasn't able to be here today, please just utilize these materials because they are really helpful, and it does help people when they are going into it the night of. Okay, that's it. So I'm just gonna go over the survey breakouts, and then I'm gonna open it up to a couple more questions real fast before we get into those, and then we will keep it moving. So for when we go to open the breakout rooms, you guys will see a little option pop up on your screen that says pick a breakout room. So room 1 is going to be me, and that's going to be for the unsheltered count. And anybody on who is signed up to be a youth specific team for the unsheltered count should attend my room. Room 2 is going to be for the sheltered count. Ooh. Oh, my slideshow ended. The sheltered count, and that's going to be Amelia, and any staff who's going to be surveying at their shelter or temporary sites, should attend that room. And then we're going to have our service-based room run by Sophie, and any staff that's going to be doing their service sites, or any youth-specific service sites, should attend that room with Sophie. So I'm going to open those up in just a second. I'm going to hang back to let people trickle through to those rooms. But once I enter my room, you guys will be randomly assigned a room. So please pick which one you're going to go into. If you are participating in multiple counts, pick the one that you are interested in knowing the most about or want the most information about, and then we will have the other information available to you afterwards. And the breakouts are going to last for about 45 minutes, and you're free to go when they're complete. I will probably hang back after mine's finished to see if there's anybody else who has any other questions. But that is kind of how the breakout rooms are going to work. So I'm going to open them up for you all. But if there's any questions before you guys start to trickle in, please just let me know.